Mondays, I treat sickle cell patients, and Tuesday through Friday, fight for them. Being at the bedside, listening to a patient have so much pain and feel like they weren't respected or feel like they just are not heard is a completely different feeling that you cannot get from any textbook, that you can't get from any public health course, but that you can only get from being there. So how are things at home? I think sickle cell is a little different than a lot of disorders because it's a disease that requires you to believe the patient. So in a sense, you have to become somewhat of a psychologist. You have to really tap into why they're going through what they're going through. Why are they hurting so much? Why do they feel like they're not being heard? Are they doing everything they're supposed to be doing before you even touch them? As policymakers and as public health officials sit around a table and make these decisions, sometimes that patient voice is not factored, and I feel like I'm able to bring that to the table. I'm able to make their voice heard. Sickle cell disease is a genetic disorder, and basically the red blood cell, which responsibility is to carry oxygen to all these tissues. In sickle cell, there's a DNA mutation, and the cell changes shape. If you can imagine, those crescent-shaped or those sickle-shaped cells get stuck in very small vessels, and they can't flow as freely as if they were round, then it causes a severe pain. I remember reading articles of when a child was born with sickle cell, you're letting them know that they are not going to live much longer. They probably would not see their 10th birthday. Now the average life expectancy for men is around 42, I believe, and women 45. It proposes another dilemma in that adults with sickle cell disease is a new discipline. And you deal with a lot of other psychosocial issues that you wouldn't deal with a 10-year-old. People listen to evidence and they manage their practices based off of evidence. So we knew that there had to be some type of evidence-based sickle cell guideline. Now we're at the point where we need to use what we have so we can at least promote more research and promote better care and some standardization of care. As a medical community, we have to take more responsibility for helping the patients.
There was one thing I did have some concern over. She's really, just looking at her mood and stuff, really down. I'm kind of a little bit concerned about depression there. She mentioned that she's actually considering going off dialysis.
First of all, that's a good assessment because most people would not pick up on that because depression is not something that bleeds, right? So what would you do?
I don't personally know of anything else we could do for her other than the dialysis.
But what about the depression? What about the depression? Even as a human being, not only as a medical professional, but who wants to see people suffer? Who wants to live privileged and see so many people unfortunate? After working in this clinic, I decided to get tested for the trait. It turned out that I was positive for the trait. So learning about sickle cell, it became personal. So what do you do?
I work for Nestle.
Oh, okay.
Laurel.
Can you give me some chocolate? This is inspiring because it brings me back to reality. It makes me realize how fortunate I am. I feel inspired knowing that I actually made a difference, that I changed that one person's life, that they came in bent over, crying, screaming in pain, and they're smiling when they leave.
I've always been a hard worker, so
yeah,
I'm the type that you got to take me out of the game.
Yeah,
you got to be the
sickle
coach
cell
that
is
says,
not.
Hey,
Yeah.
come take a seat on the bench. 'Cause I'm not the type of player that's going to take myself out the game.
Okay. I asked one patient, like, what does the pain feel like? And he said, have you ever stubbed your toe? I said, yeah. He was like, well, take that and put it on every ounce of your body and amplify it 10 times. And he said that's a good day sometimes.
I would agree with that.
That's rough.
Yeah, for the most part, I just try not to complain about the everyday aches and pains.
Yeah. You're an inspiration. Give me a hug. You're the reason I do what I do.
Thank you.